Hey y'all, today I'm just going to talk about how we're going to administer diltiazem. Before we start, I want to also touch on why we would want to use this over amiodarone. We're not sure how long the patient's been in atrial fibrillation. We're not sure if there's any clots associated with that. So we're not really trying to convert them. We're trying to rate control them. And so the way that we're going to do that is with the diltiazem. So as Dr. Squires was talking about administering it, I want to point out some things. First, I want to make sure that you're going to MAC this medication, and I would do it before we set everything up, so A, we're not wasteful, and B, we make sure that no contraindications are present. You're going to find this medication in your med kit / Bumblebee, whichever one that you guys call it. Inside that med kit, you're going to find this bag. It's got a label on it. It tells you what it's for. It also has the instructions on how we're going to mix it. You're going to find the 100 ml bag of normal saline. You're going to find the diltiazem in there with it. You're also going to find another label that will go on the medication once we mix it. And then you're going to find how you're going to set it up in the actual pump. HEMSI makes it really easy for us if you're unfamiliar with the pump. Inside your med kit as well is the IV pump administration. I have found that your partner can be setting this up as you're macking and doing putting the medication together. So moving forward, how we're going to mix this all together and make it work is first we're going to take our 100 ml bag of normal saline. We're going to pull, well, I'm going to try to pull this. It's going to pop off. And then we're going to take our diltiazem and we're going to also pull this off. That's going to give us these two things. Okay, so we're going to screw it in. Once we have it all screwed in together, you're going to come with your saline, and there's a lip right here. You're going to push down on that. It's going to put the stopper in there to get the medicine in there. I kind of mix it up and around like this. The stopper is supposed to be in there, so don't think that it's not. It's definitely supposed to be in there. We're obviously going to take our pump tubing, make sure it's pump tubing, not regular tubing. We're going to prime this just like we would regular tubing. And then finally, once we connect it, we need to put the pump tubing into our IV pump. So after we get this all set and into our pump, we have to hang this. Thankfully, the medication vial has a little tab that we just pull up, and it just inserts onto where we hang our regular medicine on the IV pole, and then we just hang that above the IV pump, and the pump does the rest for us. And then we're going to make sure that we initiate, like per the instructions, we're going to give the bolus. You can set the bolus up on your pump. It's very easy to do. You can reference the online video on ESO on how to do that. And then ultimately we're going to take this label and put it on the front so that when we take it to the hospital, they know what this is. And I usually write the time that I hung it on here as well as clock it into my monitor. So if you have any of the contraindications that are listed on the back of your MAC card. For instance, if you have beta blocker use, concurrent or recent use of them, it tells us that we're not supposed to give that drug. However, I think that Dr. Squires might have a different view on that, so this is where we would call her and ask her what she thinks of beta blockers.
And this is what medical control is for. Don't ever hesitate to call us if you have a question. You know, in this case, if Jean called me and said, hey, this guy is on low pressure, you know, a beta blocker, well, in my mind, the low pressure is not working. If he is not beta blocked, if his heart rate is 150, and I would advise to go ahead and do that. But you do want to make that call because it's listed as a contraindication, and I think you need that medical control input for that. So anytime you are in doubt about what you are going to do and whether it's the right thing, call medical control. Don't hesitate to do that. And another thing is, you know, if your patient is deteriorating on your drip, you've gone up and their blood pressure is tanking and they're still at a rapid rate, then you might want to say, okay, it's time to cardiovert. And if you do, don't do like my guys that brought me my patient and start with 100. You should start with at least 200 and up to 360, and more to come on that. Thank you, Jean. I wanted to do a little commercial for a couple of things that are exciting that we've got coming up. We are going to be having a skills fair. It's going to be for our paramedics and our personnel. It's starting at Station 2 on April 30th and May 1st and 2nd. So there will be 3 opportunities for you to sign up for this. This is going to be mandatory for paramedics. We are intending to make this fun and educational and extremely hands-on. You'll have stations, your medical directors will be there as well as several other instructors. We'll have opportunities for simulation, for practicing your skills. We're going to have different stations, and we want to make this a very productive day for you, where you get to actually try things, ask questions, and we want to make it fun. It's not testing. This is demonstrating and learning and practicing, and we really want it to be an experience that you enjoy as well as learn from. So Cindy will be signing up, having you sign up something. We'll have it sent out, and you can sign up for which day you prefer. It is mandatory for paramedics. If you are out of town or absolutely cannot do that, we'll have to come up with something that's an alternative for you. But this will be a more fun thing to do this, and this will be a real learning experience for you. Also coming up the next week after that, May the 9th and 10th, is the Rocket City Conference that Dr. Jeannie Lee is the lead on. Rick Solis will also be there and helps, and the region participates in that. This is going to be at the Space and Rocket Center on those 2 days, and it is going to be very heavily emphasizing EMS. So we'd really like you to come. We've got a guest speaker coming from out of town that's going to be talking to us about things like ketamine and patients in custody. This is going to be an excellent conference, I think, better than all the others, and also offer lots of simulation opportunities. And incidentally, next Wednesday at noon in the ER conference room, Dr. Najjar is doing another brief shock trauma conference where we talk about a case. And those are always interesting and fun and lively discussions. And EMS is invited to come to that too. So please try to take advantage of that. Thank you. Until next time. Have a good week.